Good afternoon, everyone. It's Mark Polenkars from the Rath Building. I'm going to be doing solo duty today, as Dr. Burstein is actually off, which is good because she likes to work a lot, but so it's just me today as I give you the update for the COVID-19 outbreak in our county. We have a lot to talk about, a lot to go over. We didn't have an update yesterday because at that time there really wasn't a lot to talk about. We were still waiting for case results and we did not have a whole lot of information, so we did not provide an update yesterday, but we've got a lot to talk about today. So with that, I'll kick right into it. Of course, the reminder that the presentation you're seeing this is as of the information that it was provided at the time of. It can change and does rapidly change. So the information is as normal as can be, or I should say is based on the time that it was presented, which is usually no later than 2:15. As I'm looking at the clock there that says 2:40 was the latest that the presentation was updated, but it can change. So as of 2:15 today, there were 1,057 total positive cases in Erie County for all labs. There were 112 new ones since yesterday night, in which we had a very large increase too. 26 people have died. Thankfully, none have died since we made the announcement last night of an increase of another 3. But once again, that's 26 people too many in our community. And I do offer my deepest condolences to all the family and friends of those who passed as a result of the contraction of the coronavirus and the COVID-19 illness. Positively, 167 people have recovered. So this goes to show that you can recover from the coronavirus if you do contract it, though we do know that there are people who are very ill as a result of it in hospital, as well as others who are at home, and that is because there are 864 people currently in isolation across Erie County, and there were 1,980 in quarantine. People ask us what's the difference between quarantine and isolation. Isolation means they have been confirmed of having a COVID-19 case. Quarantine means they may be, or they may have a case, it's suspected and we are aware of it, or they are in quarantine because of direct contact with another individual. But 864 people are in isolation. Those are individuals who have contracted COVID-19, and they are in isolation at home or in hospital. And 1,980 are in quarantine. As of yesterday's report, which is actually the day we received it last night, which is for the day before, because we get these at the end of the day and it lists all of the hospitalization and ICU reports for the previous day. There were 201 individuals that were hospitalized. Of those, 105 were in ICU and 99 of those had an airway assist. I decided, using my old skills from Excel as the comptroller, to put together an Excel spreadsheet and a chart looking at the increase in hospitalization, ICU, as well as ICU airway assist. This goes back to, I believe, March 27th, and it is through April 3rd. It is not for yesterday or today. We will not get yesterday's figures until later today, and tomorrow's, of course, or tomorrow we'll get today's figures. But you can see the growth. Hospitalizations of patients continue to grow. You saw a big jump there on March 31st. And what you generally, and what we're seeing, is that approximately 50% of all patients that are hospitalized, those are the blue number is hospitalized. The red dotted line is ICU. So approximately 50% of all individuals who are hospitalized are in the ICU. And on average, as we've seen over the last week or so, 90% of the patients that are in ICU require an airway assist of some type. And this is based on the report that we received last night, which would have been for the day before as the most recent day. But you get an idea of the increase in cases. We are seeing a big jump in overall cases. We have not seen a huge jump in hospitalization cases and ICU cases, which is a good thing, but it is increasing. So we are very concerned about where that would lead us in the future, but I thought it was important for the public to see this chart, which kind of shows the growth in hospitalization as well as ICU and airway assist. This is very, very deadly, as we know. 26 people have died in Erie County, and thousands have died across the world, including thousands in our own state. But if you contract this and you have to be hospitalized, there's a very good chance, at least 50% chance, that you will be in the ICU unit. So let's offer our thoughts and prayers for those that are in hospitalization right now and ICU unit, because this, as we know, is a deadly disease. It's affected people as young as those in their 30s, and as well as individuals, unfortunately, it's killed an individual in their 30s, an individual in their 40s, as well as others in 50s, 60s, and 70s and 80s. So just because you're young does not mean you are invulnerable. You can succumb to it, so we want people to understand that it is deadly and it can cause serious illness. The online case map, of course, we'll look at that again as updated most recently. The zip code feature is coming tomorrow, but we wanted to kind of give you a little preview of that. They're still working out the kinks associated with the zip code feature, but this is a draft of kind of what it'll look like. This is based off of early yesterday's figures. It's pretty jumbled, as you see there. But on the side of the map, you'll also have a listing by zip code. So if you don't know exactly where your zip code is and trying to figure it out on the map, you can go down the side chart and find it there. So you'll be able to identify it by zip code. We know people are interested in zip codes, so we decided to provide the top 10 zip codes as of yesterday morning. We do not have the latest broken down by zip codes as of today, but the largest case cluster was in the 14215 zip code, which is in the city of Buffalo on the east side. The next largest is 14221, which is the village of Williamsville and a good portion of Amherst, as well as a little part of Cheektowaga, and I even believe a little part of Clarence. That had 57 cases. There were 69 cases in the 14215 zip code. 14075, 36 cases, that's Hamburg. 14226, 34 cases, that is Amherst. 14224, that is the town of West Seneca, that has 32 cases as of yesterday morning. 14220, that is South Buffalo, that has 30 cases. 14150, that is the town of Amherst, that is 29 cases. 14208, that is the city of Buffalo in part of the east side, has 26 cases. 14225, that is Cheektowaga with 26 cases, and 14216, that's North Buffalo in the city of Buffalo, once again, pretty much the North District and part of maybe even the Riverside. That's 25 cases. So this is as of yesterday morning. This will be updated and will be changed with the map in the future, but we wanted to give people an idea of the top 10 zip codes to show that the predominant amount of zip codes, if you do it, is the city of Buffalo and the town of Amherst. And there is a cluster in the east side of Buffalo. There were some that were saying that we weren't testing individuals on the east side of Buffalo. That is incorrect. We have been testing, and in the two top 10 zip codes are two zip code districts that are in the city of Buffalo's east side, 14215 and 14208. And then you are looking at 220 and 216 in the city of Buffalo, 220 being South Buffalo, 216 being North Buffalo. Then you have Amherst predominantly in 221, 226, 150. So we want people to understand that the zip codes track very similar to the town numbers with regards to growth. So we'll have that fully updated. The map will look a little like this tomorrow, except with the latest numbers. And we want people to understand that if you have trouble reading the map, not knowing exactly the zip code where it lies in the map, you can go to the chart on the right. Community self-monitoring, if Dr. Burstein was here, she'd tell me to check daily your fever. If you have a fever, if you have a 100.4 fever degree or higher, and you cough and shortness of breath, those are the classic symptoms of COVID-19, but there are also sweats and chills have been reported. Extreme exhaustion, as well as loss of senses of smell and taste. If you have these symptoms, there's a very good chance you may have contracted COVID-19. It doesn't mean you've contracted COVID-19, but you may have, and you should definitely monitor yourself in that situation. If you develop symptoms, isolate yourself at home from others in your household. Call your physician. Do not go directly to their office or an emergency department or urgent care, and to to affirm that, call your doctor first. Do not go to the ER or urgent care. If you do, there's a good chance you're going to get it because it is in the emergency rooms, it is in urgent cares. So we want people to understand that and to keep the ideas in mind that if you have these symptoms, call your doctor first. Your doctor will advise you on what is appropriate to do. There was some bad advice that was coming out on social media today regarding home remedies, including these Twitter pages that mysteriously appeared in the last few days with no followers. They're not following anybody. Those are usually bots. They got a really elongated handle with numbers. So we want you to understand, don't believe what you see on social media. There's a lot of false information out there. There were rumors flying yesterday about confiscation of ventilators, which were incorrect and false, and we're doing a disservice to the public when you're sharing false information. But don't trust what your Aunt Ginny puts out there. Trust your doctor. Trust your physician. Now, we are aware, of course, of a cluster of cases that has occurred at the Father Baker Manor Nursing Home in Orchard Park. This is actually very close to Chestnut Ridge Park. So the Erie County Department of Health is working with the New York State Department of Health and Catholic Health Systems regarding a cluster of COVID-19 cases at the Father Baker Manor Nursing Home in Orchard Park. I've actually been in contact with Mark Sullivan, the CEO of Catholic Health. I know that our Dr. Burstein has been in touch with Dr. Young from the New York State Department of Health, as well as the infectious control disease expert from Catholic Health. We are monitoring this. It is a concerning situation to us. There were 17 reported cases yesterday. We can confirm as of this afternoon in the morning numbers that as of this morning there are 39 confirmed cases of patients at the Father Baker Manor Nursing Home in Orchard Park. Staff tests were completed yesterday. The samples, I should say, were taken yesterday. Those results are pending. So we're hoping to have those results by the end of today. But we can confirm that I believe there's like 130 or so patients at the Father Baker Manor Nursing Home, but 39 of them have tested positive for COVID-19. So we are very concerned about a cluster and an outbreak at that nursing home, and our Department of Health is in contact with the New York State Department of Health. And once again, the New York State Department of Health is determining the standards for containment and care with Catholic Health Systems. We are monitoring it. We are not on site, but the Department of Health is working with Catholic Health and I say Department of Health, the New York State Department of Health is working with Catholic Health to determine the containment of it, to prevent the further spread to the other residents who don't have it, as well as what can be done for care for those patients. We are certainly thinking of them because we know, I saw a list of the patients earlier. There are quite a number of them that have contracted it that are in their 80s and some in their 90s, others in their 70s. So we are concerned about the well-being for the patients who've contracted the COVID-19 illness through the coronavirus at the Father Baker Manor Nursing Home in Orchard Park. Our response, the New York pause orders, I was out yesterday for a little bit. I checked on a couple parks. Elma Meadows was really good. Our golf course is closed, but there were people out but walking, and they were keeping a safe distance from each other. I was happy to see that. I went to Como Park, a little different story. Lots of people were there, including what I saw, which I didn't like, which was people congregating, multiple cars parked close to each other, congregating, hanging out. We need you to stay apart from each other, at least 6 feet apart. Didn't seem like that was happening in what I saw at some of Como yesterday. We did open up an extended portion of Como that had been closed for the winter. We believe that helped out a lot. Most people appear to be following the guidelines of staying distant at least 6 feet or more. Not everybody was. That's a bad thing. Now, we have had lots of complaints regarding non-essential businesses. There is a phone number to call, 1-833-789-0470 to report a non-essential business or other type of operation that's open. You can also file a complaint online. You see the long page number, a name is on the screen. That is also being put on our Twitter page, and it will be put on our Facebook page soon. So you can also file a complaint online, but the best way to do it is a call, 1-833-789-0470. Complaints from employers, or I should say complaints about employers from employees, go to the New York State Department of Labor. They're sending folks out, and there's a long webpage there you can go to, but we want you to know, go to New York State Department of Labor and you can get that webpage. Now, I'm going to say something because it's serious. Enforcement powers. Enforcement of the pause orders from Governor Cuomo is enforceable by local law enforcement. I've spoken to a number of individuals, including Mayor Brown and Supervisor Culpa in Amherst and others, and they are set to have their police force go out there. We've also talked to other law enforcement, and I believe they understand the seriousness of the nature. If you violate a pause order, which is part of the health law aspects of it, anyone is subject, because it's a civil penalty, up to a $2,000 first-time violation. When's the last time you got a ticket for $2,000? It can happen. A second violation is $5,000. And this is not just businesses that are inappropriately activated and open. This can be individuals who are violating the 6-foot standard. They're writing tickets in New York City for big dollars. They're writing tickets in Washington, D.C. They're doing it in other places as well. Willful violation of the health law. This is really directed to the business people out there who are willfully violating the governor's pause orders, and we've heard of a number of them that are planning on opening in the next week. I'm letting you know it is a criminal misdemeanor. It can be enforced by all local law enforcement, including your city, town, and village police. Your first-time violation can be up to $10,000 and or a 1-year imprisonment. So to you business owners out there, I've heard of collection agencies and some other types of companies out there that make products for others but are not essential products at this time. You are at risk for not only big fines but imprisonment. I would recommend not doing it. For the violation of the health law, you can, and that could be basically 15 people congregating together, walking their dogs together. You could be ticketed too, and you could get up to a $2,000 fine. Folks, take it seriously. If we don't stop the spread of the coronavirus and COVID-19 cases in this community, many, many more people will die. Thousands upon thousands will be hospitalized. We are taking this very seriously, to the point we have our masks in the building. The other 2 people, and there's only 2 other people in this room, are wearing masks right now. You need to follow the rules. If you have an exemption from New York State, you better put that exemption on your front door. Because if you're operating and we get a call that you're operating, we're going to let local law enforcement know. And if you don't have an exemption, you're going to be in big trouble. So I just want to let everybody know that there are powers that go to local government with regards to the pause order. It was further guidance was provided earlier this week by the governor's office. I thank them for providing this further guidance. But this is serious, folks. This is very serious. We know our peak is not coming for some time yet. We are still a number of weeks behind where New York City is, where Westchester and Long Island is. I've talked to my colleagues in Long Island. It is not good down there. They're seeing huge upticks in their hospitalization as well as their deaths. There are more people, last I saw, who have contracted COVID-19 in Suffolk County than the state of Florida. It's in New York State. It's bad downstate. We know it's going to be bad across the country. We're behind where they were, or where they are right now, I should say. And we want everyone to understand the only way we're going to keep that spread from going everywhere is to flatten the curve. Flatten the curve by only going out for essential items, only going out with your family. Do not congregate with others. You're putting yourself or the others at risk in case they have it. Now, I never thought I'd be doing this at a press conference, but I have to do an update from our sewer division. Our Department of Environment and Planning's Division of Sewers Management is reporting non-usual items are being flushed down the toilets. How do they know? Because it ends up getting stuck at our sewage treatment plants or getting stuck in the lines along the way. Our sewage treatment plants have big Archimedes screws, stuff that goes back like 2,000 years, and they can pull out things before it gets further down the line into the plant. And they've seen all kinds of stuff. they've reminded me to tell you to only flush down the toilet the 3 Ps, which, as you see in this little picture here, toilets are not trash cans. Only flush the 3 Ps, pee, poop, and toilet paper. I never thought I'd be having a press conference having to tell people that. One of the items that we've seen come through our sewers and get pulled out before it clogs up the rest of our sewage treatment facility is insulation paper. The special paper you buy at a building supply, which is a heavier duty paper that is used in like crevices and nooks and crannies for insulation. My God, people, there is toilet paper out there. You can find it. Please don't flush anything down the toilet other than the 3 Ps, pee, poop, and toilet paper. I can't believe I have to do this, but that is what we have to do because our Division of Sewage Management is advising me that this stuff is coming through. And if it gets through, it can clog and cause problems to our sewer lines, causing backups into homes, which of course, none of you want to have a backup of sewage in your home. You certainly don't want to have it in your street and have it come up from the rest of your street. And we don't want it in our sewage treatment plants where we have to clean it out because it causes problems with our treatment. So, look at the picture. We know it's supposed to go in the toilet. The 3 Ps, nothing else. Hopefully I never have to bring that up again. COVID-19 call center, of course, it's open 8 a.m. to 8 p.m. daily. 716-858-2929 is the phone number. It was pretty busy earlier when I was down there. We have a couple different sections for the call center. So I just want to remind people, call it 716-858-2929 if you have a health-related question. If you have a non-health related question, you can call 211 for just general service information about Erie County government or another government or maybe a business that might be open. If you call our call center, please do not call with hypothetical questions. They're not going to be able to offer you much with a hypothetical question, but if you have a legitimate question, they can answer it. Of course, our COVID-19 webpage at www.erie.gov/COVID-19 is available, and it has a lot of information for all different types of businesses, healthcare professionals and the like. Go there if you want to research more information. I just want to apologize once again. We don't have a deaf access interpreter today. Unfortunately, they're really working very hard. The interpreters, Kendra's been here a lot. I know Kathy's been here, Jennifer's been here, but they're also doing service for other governments and people too. And for them, they also have full-time jobs. So I want people to understand I do apologize for not having a deaf access interpreter here today. Important resources, once again, our COVID-19 page at erie.gov/COVID-19 has all the information you could ever imagine with regards to what we have in this community. With that, I'll just go to the map just to once again show there are 1,057 confirmed cases in Erie County. There are active cases 864. 167 have recovered and 26 unfortunately have passed. Tomorrow in this corner, the side over here, will also, you can have 2 drop-down menus here. You can look at the town total, which will show the towns, and you'll also be able to click here and pull up the zip code. So you can pull it up by zip code, and then you'll also be able to review the zip codes. And then we have a chart on the left which shows the growth of cases on a daily basis, so you can determine how many new cases we had per day. Once again, I just want to thank everyone for the good work that you've done to create a better community over the years, but also what we need to do to protect ourselves and our loved ones and our friends and family. Stay home. Don't go out if you have to. You're only putting yourself at risk when you come in contact with other individuals, and I truly don't want you to have COVID-19. I know a few people who have contracted it. Thankfully, all of those individuals seem to be okay, but some of them have had a little rough time during it. I know of others that are in the hospital, and I know of a friend of mine who has a sibling in the hospital. Unfortunately, he's on a ventilator right now, and certainly offering my deepest thoughts and prayers for each and every one of the individuals who is in a hospital on a ventilator right now. We're going to get through this, but we have to get through it together. We have to be our brothers and sisters' keeper, which means we have to act smartly, save lives by staying home, stopping the spread, and we will reduce the number of hospitalizations, we'll reduce the number of deaths. If we don't, if we just go about our own business, I saw kids hanging out yesterday, teenagers can get this, teenagers have died elsewhere, you're not going to stop the spread, and it's going to cause more harm and death. So people, please listen to what we're saying. With that, I'll open it up to some questions from Facebook. Dan Myers here. Dan will ask me the questions.
Sure, Mark. We have a number of questions from both media and constituents, including WBTV, News 4 Buffalo, looking for you for some guidance on gloves and masks. People are seeing gloves and masks discarded at various places, including store parking lots, in the parks, near bank ATM entrances, near fast food drive-through lanes, and near ice cream stands and shops. Can you let us know the importance of discarding these items appropriately?
Any of these PPEs, these masks, gloves, other types of gowns, if there happen to be in a setting that has them, there are proper ways to discard them. You can throw them in the garbage, put them in a garbage bag. They will be collected. Close up the garbage bag like everyone else. Do not throw them along the side of the road. If you're throwing them along the side of the road, our Department of Public Works and the other Public Works folks eventually will have to clean them. If you're throwing them in our Parks Department's folks have to clean them. You can put them in trash receptacles and bins, but please don't throw them in litter. I mean, it's bad enough littering in the first place, but then our individuals who are going to have to clean this up have to be properly prepared themselves with masks and gloves as they go out there to collect these. Be smart, folks. Don't be pigs. Don't throw things out there. You're endangering others. You throw it along the side of the road. You throw it in a park. You never know, a kid may pick it up. They don't know any better. They see the mask. They think, hey, it's a little parachute. They may pick it up. And who knows if it's got a COVID-19 virus on it or not. Throw it out in a proper receptacle. Don't be a jerk.
Okay, next question comes from WGRZ-TV, Channel 2 News. Elon Musk said Tesla would make ventilators here in Buffalo. Today, Governor Cuomo said that has yet to happen. Have you heard anything new on that? And related with another media outlet, any other companies locally you know that are interested in making ventilators?
I do not have any evidence to prove that Tesla is making ventilators in the Buffalo plant. I know that the discussion was, but I did believe that it would be weeks away before it ever happened. Their current tools, their system is designed to make solar roofs. It's not designed to make ventilators. They also have a portion of the plant that is a construction area that builds the big power plants for the drive-in Tesla charging stations. Not the charging stations themselves, but the power portion of it is built here in Buffalo. I would assume that's the section that would be converted into ventilator construction by Tesla. Because it's basically the same idea of getting parts and putting it together. But as of right now, I have no evidence that that's going on. I've not heard from Tesla that it is, nor my staff. And I know that there are some manufacturers who have talked about converting, but I do not know of any manufacturer who has actually converted to making PPEs or other types of medical equipment here in the Buffalo area.
Okay, this is a Facebook Live question, and we have related questions that came into your office on Friday on this. With all the focus in recent weeks about lung illnesses and breathing troubles, have there been any discussions locally or at the state level of government to temporarily or permanently ban the sale of tobacco products?
I am not aware of any discussion regarding the temporary or permanent sale of tobacco products. There was a rumor that spread about a week ago that said the governor was going to issue an order banning the sale. That, of course, has not happened, and he has vehemently denied that. It is my understanding, because the tobacco products are regulated by the FDA, that there are no changes on that. So the feds, I do not believe, are going to be regulating tobacco products. There is regulation, of course, of vaping, but New York State has not indicated any further changes in vape regulations. So for now, it is my understanding that it'll continue. We are aware that if people have smoking or vaping, they smoke or vape, that they are more at risk with regards to contracting COVID-19 and having a worse illness. We all at the same level of contraction. We can all contract it, but if you smoke or vape, you have a higher risk of actually suffering serious illness. So once again, if you were thinking about stopping smoking and stopping vaping, now's the time to do it.
Okay, another question here, WGRZ-TV, Channel 2 News. Do you anticipate making any changes at the county parks in order to ensure social distancing? And in your communications with the various cities, towns, and villages, is there anything more we can expect from those individual governments about enforcing social distancing? You touched on this earlier, but anything else you could see in the horizon?
I have been in contact with our Parks Commissioner, Troy Schinzel, as well as the Deputy Commissioners, Mark Cornell and Jim McDonald. They've been traveling out to the parks. As I said yesterday, I myself went and checked out Elma Meadows and Como Park. The golf course is closed in Elma Meadows. The golf course at Grover Cleveland is closed. There's no golfing going on. Our beaches are closed, so there's nothing going on in the beaches. But our parks have been busy. Elma was pretty good, generally fine. Como Park was busy, but except for a few areas, people were observing social distancing guidelines. Chestnut Ridge has still been a problem. We've had varying reports with regards to the Eternal Flame Trail. We actually sent our rangers out there as well as others to check on it, and it seemed to be okay yesterday. It was at the parking lot was not full. It was only at about half capacity. It was okay at that time, but it can vary. We are concerned, and we are going to take steps if we have to. I've reached out to the sheriff's office, asked them to consider also following the enforcement of the pause orders if needed, if people are ignoring it. I know the city of Buffalo, the mayor and I spoke today, and they're shutting down Ring Road in Delaware Park for driving. You may not be able to drive on Ring Road anymore. Parking will be potentially available at the zoo lot because they're just afraid of the congregation of vehicles. So we are concerned. We're keeping an eye on it, and it's why I talked earlier about enforcement. All local government, local police departments have the power of enforcing the pause orders, and I call them then to enforce it with regards to businesses. Our Department of Health sanitarians will be enforcing it with sheriff's deputies, but local governments can do that as well. And if there are people who are ignoring the social distancing standards at parks, if they're using a shelter and there's 20 people there with kids running around, you should get a ticket because you're all at risk of spreading it, and who knows who gets it then. If you go home and you see your parents and your parents are older, you may infect them. This is really serious, folks. We do know that almost all the new cases that we're aware of, they're all from community spread, but the deaths, the vast majority of deaths are from community spread too. It's not as if these people were traveling out of the area. They got it from someone else. And it's just wrong because you're putting someone that you love or someone that you care about at risk. So just leave it at that. Next question.
Okay, from the Buffalo News, as our county executive, Mark, what are you most concerned about in regards to our local medical readiness as the number of COVID-19 patients are expected to spike?
I am worried about hospitalizations at area locations. As I showed, actually I should go back and grab my PowerPoint again and just find the, I can't see, there we go. I was having trouble seeing the mouse. But the hospitalization curve, so to speak, we are seeing an increase. It basically have had a doubling of patients in a little more than a week, so that's not bad considering we've seen a big increase in cases during that period. So I want people to understand that we're seeing hospitalization increases, and we're going to continue to see hospitalization increases. We're worried about the PPEs that we have for not only our staff but also for the hospitals. We've got some big orders that are allegedly coming in. I've talked with the Sheriff's Office about being on site with our Department of Public Works and others, with our Commissioner of Public Works, Bill Gary, when those shipments land, so that they are not confiscated by anyone else. So we want to ensure that when these shipments are here from Taiwan and other places, that they come to us and not be confiscated by others. And I am worried because I've seen confiscation reports by the federal government of orders from different states elsewhere. So I want people to understand we're taking this seriously, and we're going to be prepared to protect the goods that we've ordered so that they come here for Erie County, so they're used by the personnel in Erie County as well as hospitals, first responders, law enforcement. If we get those, I think we'll be in much better shape, but I am a little worried.
Okay.
Next question.
Next question is from Spectrum News. You say on a regular basis you talk to local, state, and federal officials. Since you last spoke to the public on Friday, has there been any word from the state or the feds on if we'll be getting any additional test kits?
Yes, we are getting more test kits. We're anticipating getting more test kits in the upcoming week. Our Department of Health has been discussing with Kaleida Health about the ability to do more work associated with doing the tests and then internally testing the samples through our Department of Health as well as Kaleida Health. We have test kits right now. It's not like we're not testing. We are testing. Our testing numbers have ramped up. It's one of the reasons why you've seen big jumps with regards to cases in the last few days. So I think it's important. Oh, I've been told you can't see the graph. Well, it's probably because it's in white. Anyway, but you can see the graph on page. You can see it on Twitter. So sorry about that. So we'll take that graph off. But we'll go back to this and show that 1,057 total positive cases, 26 passing, 167. But I want people to understand that the numbers are going up, and we are prepared for much larger increases in the near future. But we're going to keep an eye on this as best as we can so that we reduce the risk to others by seeing these dramatic jumps with regards to hospitalization and the like.
Gotcha. All right, Mark, here's a question came from a constituent. We keep hearing from you and Dr. Burstein that first responders and healthcare workers are able to get COVID-19 tests, but research shows that globally the best results at keeping the infection rates and death rates down is due to mass testing. How can we stop community spread here in Erie County with the limited amount of testing, especially when you consider essential employees like grocery store workers, gas station attendants, and large retail cashiers come in contact with hundreds of people every day when they go to work?
It's a valid point, but unfortunately there really is not mass testing in the United States where everyone who wants one can get one. Even in New York City, where they've done tens of thousands of tests, you're still talking about a place with 13 million people. So they have not done as mass testing as they'd like to in New York City or Westchester County. We would like to see that, but we don't have the capability at this point. So until we have such time, and we believe that testing capability will be ramping up soon, and we think we'll be able to increase testing in the next week based on the numbers that we are receiving with regards to new test kits that'll be coming in. The shortage in the test kits seems to be being alleviated. There's more test kits that are coming in and reagents coming in. That's a good thing. We also have been in touch with the manufacturer of the antibody test, which is a test to basically determine if an individual has been exposed and do they have antibodies. We hope to have that soon. We've attempted to get the laboratory tests, but unfortunately these are not available. They're only going to state health departments at this point. I told them to put in an order for as many of those Abbott Labs test kits as well as the testing machines themselves, the analyzers, and we were told we can't get them. So we're doing the best that we can in a very difficult situation.
Another question from WGRZ-TV, Channel 2 News from their sports department. What do you think about the discussions of resuming professional sports in the near future? Can you envision professional hockey and football being played in packed venues, including Erie County, as soon as this summer?
No, at least not hockey. I don't think they're going to finish the NHL season this year. I think this is going to continue at least through this month. Maybe they'd be able to pick it up and finish it in the middle of summer. Football, still a ways away, but we're expecting an increase. Well, I should say this. What we've seen are models that show is continuing through the summer, though maybe lessening in the summer and then picking back up in the fall. And I'm not so certain that we're going to have professional sports for a while. I don't know if they'll have an NFL season or not. It's months away. This is actually the beginning of one of my favorite weeks of the year. It's Masters Week. And this is a week I look forward to. And there's no Masters, of course. But I'm not looking forward to this week because I think there's going to be a lot of more cases in our region as well as hospitalizations and deaths. I'm hoping that the peak comes much sooner than later, but we really don't know. We know we're about 3 weeks at least behind where New York City and downstate is. They're hoping for their peak, as the governor's noted, in the next week, but we might not have a peak for a while now. And even then, there's still going to be cases. So we're hoping for the best, but the only way we're going to see a true flattening of the curve is if people stay home. If they don't, we're not going to see a flattening of the curve. We're just going to see a lot of hospitalizations and deaths. And I hate reporting deaths. I don't want to report any more than I have to, so please stay home.
Question mark from WKBW-TV, Channel 7 News. In regards to sending supplies downstate, just circling back since you were last speaking publicly Friday, has there been anything more to discuss or announce regarding talks with the state on moving supplies that are currently here in Erie County? How much can Erie County provide while still taking care of the ill here and expected ill here?
I've had multiple conversations with members of the governor's staff, including Lieutenant Governor. The governor, as we all know, made a statement a couple days ago saying they would employ the National Guard and has sort of backtracked from that. They're saying they hope and would ask that hospitals, if they're not using their ventilators, would provide 20% of their unsupplied or unused ventilators. As we've seen, our ICU and our ICU airway assist is going up. We are very concerned about that. I do not believe they're going to come and confiscate ventilators. I've had enough conversations with the governor's staff to believe that that is not going to happen. We are getting a lot of our PPE supplies from New York State, so it would be silly for them to provide us the supplies and then immediately take them back. So I think that they're divvying up supplies based on where it is needed most. We've had a couple deliveries of PPEs from New York State. I am thankful for it. I do appreciate it. I don't anticipate seeing any confiscation of ventilators or other PPEs by the National Guard. I just don't. I think the state has realized that that is not a smart thing to do.
Okay, this is from a couple different media outlets and a couple people through Facebook. Have there been any other locations in Erie County that have recently been identified as possible makeshift hospital sites? These could include hotels, indoor sports facilities, banquet halls. Has there been anything more that we should be aware of, or is there anything people can do to offer potential locations for makeshift hospital facilities?
At this point, we have identified the convention center as the primary location. We are in a line, so to speak, because they're dealing with so much right now in New York City. They're looking at continuing to expand in New York City because they need the hospital beds. Thankfully, we don't need them just yet. We are considered at least not a hot spot compared to others when it's talking about hospitalization and ICU usage. Other areas, they're turning their hospitals into total ICU units, and they're moving people who don't have COVID-19 out elsewhere to other facilities. We are not at that point yet. We do have a number of places identified. I just don't want to talk about it at this point other than the convention center, which is would be the primary location, where we hope we could get a 1,000-bed ICU COVID-19 hospital there. At this point, there are still over 1,000 beds available in Erie County hospitals. There's still ICU beds as well. We're hoping to flatten that curve of hospitalization, which I hope you see, but unfortunately, because I was in white, I'll have to change that for the future. We'll be able to change the color so you can see it better in the future. I think it's important to note that we're first going to put people in hospitals, and if we have to activate the other locations, we will activate them. The Army Corps of Engineers, as well as FEMA, has sort of provided us the guidance on what it would be like if you're going to take a hotel and turn it into a hospital, or take a large mass area like the convention center and turn it into a hospital. We have looked. We've identified a number of potential locations, but until such time as we're getting really close to need it, we're just not going to announce it, other than the convention center.
Okay, question from WBTV News 4 Buffalo. Hot topic included in your office, Mark. A lot of calls at the front desk on this regarding essential businesses, and we're talking about landscaping, things along those lines. One contractor reported they witnessed another company doing a full service revamp, not just maintenance, cutting grass, but doing things such as spreading mulch and bringing in large orders of mulch to be spread later in the week. These are local businesses that are trying to beautify their areas. Can you clarify in terms of what is essential when it comes to landscaping, and if possible, how people can report this? Do they go through us at the county? Do you contact your local code enforcement with your municipality, or do you report it to New York State?
Well, you can report it to New York State. You can call this the number here, 183. Let me make that bigger. 1-833-789-0470. You can, if it appears to be a willful violation of the law, inform local law enforcement. They have the ability to file or actually do a civil ticketed violation, and it is punishable, as I said, up to a 1-year misdemeanor for a criminal violation of the health law. My understanding, from what I've been told, is that landscapers are there for just basic maintenance, such as cutting of grass, cutting of bushes, maintaining just basic needs, not bringing in all kinds of new stuff for the summer season. I guess you can buy mulch yourself and put it out yourself, but landscapers are not supposed to do it because people are coming in contact. That means they have to acquire the mulch, they have to go somewhere else and get it. It's one thing if they come out with a lawnmower. I actually know there were a few people who were very angry about this on social media, saying you're taking away my livelihood. There's a lot of people who's lost their livelihood. We're not doing it because we think it's appropriate to take away your livelihood. We're doing it to protect lives and keep people alive. So we want people to understand that landscapers they have to follow proper social distancing guidance. If they don't, you can immediately get hit with a violation of a health law. So if 2 of your employees are standing like this close, doing work, you're in violation of the law. You could get hit with up to a $2,000 first fine. So is it really smart to put all that mulch out there? To put those new bushes out? No, it's not. You're just as risky as anyone else. Don't be dumb. Don't hurt somebody else. There was an old saying, you can't stop stupid. Well, maybe you can if you enforce the law, but I just want people to understand you need to follow the law. Otherwise, you're putting yourself and other people at risk for a disease, an illness that has killed 26 people in Erie County, has hospitalized hundreds, and has infected now more than 1,000 with confirmed cases. There's estimates for every confirmed case, there may be 10 or 11 non-confirmed cases. So that means there's at least 10,000 people in Erie County that have it, and it's probably more, much more.
Okay, Mark, this is a question that came in through your email here on the 16th floor of the Rath Building. Leanna is actually a sign language interpreter who stood next to you back when we had some weather incidents. So she said to say hello. She hasn't been with us
Hi,
recently,
Leanna.
but her husband owns a landscaping business, and actually he decided to do the right thing and donate approximately 30 N95 masks. He's kind of doing a personal challenge to other small businesses to donate their small mass supplies of N95s. She wants to know what's the best way to spread the word to his colleagues and friends, and if you could share that now and on your social media, how can people donate masks that they know they won't need in the foreseeable future, and they want to give them to the folks that need them, most importantly, those doing the great work on the front lines?
You can donate your masks to Erie County through our Department of Emergency Services, or Homeland Security and Emergency Services, which has a form that you can fill out. Hopefully I can find it. Where is it? Actually, you have to go to our COVID-19 page, I probably think.
And while you're searching that, Mark, we can remind everyone they can call your office if they have specific questions that we could help out with at 858-8500. And of course, the hotline is 858-2929 for COVID-19 related topics.
Oh, I am not finding it, and it's bothering me. There is a page that our Emergency Services Homeland Security has put together where you can fill out a form. Maybe it's here. We have a really cool Emergency Services Department, but I'm not finding what I'm looking for right now. But there's a page in which you can fill out, and I'll make certain it gets put on the Twitter pages on the website, in which it is a link to fill out a form that says, I have this N95 mask, I have gowns, I have what it is, and I'd like to donate that. And you can donate it then through our webpage. Let me just try the basic erie.gov and see what I get. Maybe it is there.
I've seen it too, I know.
I know it exists, and now I'm going crazy trying to find it, and it doesn't look like it's here. I guess we need to include that one on our main page. There's the frequently asked questions. Maybe we have it was updated on the 4th. Maybe we have something regarding donating of N95s here, or other things. Sometimes we're doing this on the fly, folks. It's not always pretty. Should I wear a mask? Yes, you should, I believe, and if you're going out in the general public, and you are going around people that you have not been around. See, these are all the cool things I can find.
It is on there somewhere.
It is on there somewhere. Well,
we'll find it and share it via social media and otherwise, yeah.
So Thank you, Leanne and your husband, and for others, I would ask you to do the same. If you have these types of masks and so forth, please donate them. They'll go to good use here with our public health professionals, first responders. Next question.
Next question, Mark. It comes via WBTV. Can you reassure, and another media outlet, can you reassure us in terms of we have a family member or a friend who's at Father Baker Manor? What advice do you have to someone who knows they have a family member or friend there, obviously with this recent attention given there to that facility, and what can you do to reassure folks that have loved ones then in that facility, as well as folks that work in that facility?
Well, the New York State Department of Health is on site working with Catholic Health. They're coming up with a containment plan. I do know all staff was tested yesterday, and we're anticipating results today. So that will be a little bit of a time until they'll be able to identify and notify all staff with regards to the testing results. To the individuals that are worried about your loved ones, I fully understand why, but if there's anything that can be said is that the Catholic Health has designated a certain team to address it, as well as the New York State Department of Health. They're monitoring it. If individuals require further hospitalization, they will be taken out of Father Baker Manor and put into a hospital setting. I would imagine that they would end up going to St. Joseph's Hospital, which is the COVID-19 hospital that's been created by Catholic Health. We are just monitoring it ourselves. We are getting the facts with regards to the number of people who've tested positive. It is a big concern. I learned about it 2 days ago with regards to the initial tests. We found out more about yesterday about the number. So I heard it was around 40, and then we got official confirmation this morning. It was 39. So we are concerned, and you should be concerned too, but at least know that they have been tested. There are healthcare professionals on site, and everything should be done to ensure the safety of not only the patients and residents at Father Baker Manor, but will also be done to ensure the safety of the staff.
An update for you, Mark. We have a number of county employees, even their day off, watching these daily updates, and one of the staffers from the county legislature did post the link that we were just looking for in the live feed here, and we'll be able to post that to your Twitter and others there. So we appreciate the thank you there from a friend in Springville, New York. Another question for you, Mark. So this is someone who has children at home, and the kids are getting antsy. That being said, we're trying to teach them the importance of reading, even during times like this. Can you recommend a good book for someone in the middle school age grades 6, 7, and 8, going back to something you may have read, or maybe your nephews or someone else that you know would be a good book that they said maybe involves either something fun and important and recreational-wise, or maybe providing guidance and advice on leadership, and maybe one of these children individual has interest in government and maybe following in your footsteps someday.
I don't know if there was any book that led me to become someone in government, though when I was in like middle school, 6th, 7th, 8th, 9th grades, though I certainly was a big fan of history, and I did enjoy my history classes and learning about history. If you want to know about leadership and you're a 6th grader and 9th grader, maybe probably should read some Harry Potter books, because Harry and his friends did some really good leading in very difficult times, and maybe we could follow them, which is try to figure this out, go to a logical analysis, do about it in a calm manner. Although Ron Weasley wasn't always so calm. But do it in a manner that in the end we figure out how we're going to go about this. We understand sometimes we have to take some risks, but we do it in a smart manner that benefits all. I would just say to each and every one of them out there is take away the electronic devices at times. They don't have to have this all day. Take it away from them. Take the iPads, the tablets away, and give them a book and let them explore through a different way. One thing I have heard from that parents are worried that they're already seeing a drop-off, especially from schools that are not doing online learning, for the students not reading, not doing their mathematics. So it's important that you do keep that up with your children, even if it means you just review the last things that they were doing for like the month before school ended, so that they still are keeping abreast of the items that they were learning beforehand, because we all know what it's like. We learn something, and if we don't use it, we forget it. We do that today. I can't remember half of the books I read when I was younger. I pretty much can't remember 100% of the books I read when I was younger, other than maybe Curious George when I was very young, or Green Eggs and Ham. But for the rest of us, we have to continue to engage ourselves in new material, and we need to do it with our children as well. Because if they're not learning anything, if they're not rehashing what they previously were taught, when they go back to school, they're not going to remember it. So it's very important that we give them an opportunity to explore the world that exists, the universe that exists out there. Our libraries are closed, but our electronic libraries are open. So if you're going to give them a tablet or a Kindle, you can download books for free through the Buffalo and Erie County Public Library System. So think about doing that. Go and search online, find a book that they may be interested in, and read it together on your laptop device. Otherwise, take those devices away from them and give them a real hardcover book and let them explore, as people have for hundreds of years, the joy of reading. And we'll take a couple more questions.
So 3 more questions, Mark. 3 more. Related, you say you have regular dialogue with city mayors, town supervisors, village mayors. What are you hearing between you and Dr. Burstein on a future conference call with superintendents? A lot of parents at home, a lot of students, a lot of teachers wondering about the future of school for the rest of this school year, and already some speculation about next fall.
Well, when we first, when we last talked to the superintendents, we were going to revisit this on a 2-week basis, and I think we all understood, and then there was a discussion to close schools through April 20th. I do not believe schools will be open on April 20th and the 21st. I think they will be closed at least through the remainder of this month. We're probably not going to hit our peak until the end of this month. At the earliest, might be May. So I'm going under the assumption that schools are still going to be closed through at least the remainder of this month. I don't know about after that. We'll continue to have conversations. I think the school superintendents and teachers should be following on to the recommendations from state and governmental officials here in Erie County, knowing that we are still seeing a growth in cases. We're seeing a growth in increase in hospitalizations. I do not anticipate that schools will return this month. It's not my call, at least originally. It's up more to the state than anything else. We will continue to provide, as we go along this month, further information to school districts, but I'm going under the assumption that we're going to be in this situation for the remainder of the month, which is very similar to what the president and the governor have said too. We're basically going to have these stay-at-home orders at least through the end of April, and that's going to coincide with the April 20th date that was set for school resumption. I don't think we're going to have school resumption. The closer we get, we'll have a better idea. But if I was a betting man, and I don't bet a whole lot, but if I was a betting man, I'd be putting my money down on no school in April and probably the first couple of weeks of May at least.
Okay. We also have some former county employees watching along. Question regarding social distancing. There's been some talk about senior citizens in particular in condos and senior housing doing meet in the street cocktail parties, things along those lines, where they bring lawn chairs, cocktails, and snacks that they don't pass around, but they're saying they maintain 6 feet distance and just to gather together in their community. Your advice on these suggestions? There's more and more of these. Sounds like the people are planning for the rest of this month, and there's already talk about bigger, they said in quotes, parties into the month of May. What are your thoughts on this as it relates to the governor's pause order?
It's not a good idea. I've heard of these. We're seeing much more hospitalization increases lately, and as we said, we basically doubled the hospitalization in a week, which is at least, we're not doubling it every other day. The people who are hospitalized are generally over the age of 60. They're not all, but generally are. And I would not recommend congregating in these condo parties or whatever. Maybe we need to send an ambulance over or the medical examiner's office and just line them up waiting for somebody to keel over. I'm somewhat being funny and not, because someone's going to pass it. It doesn't take, all it takes is one of those seniors to sneeze, and they have it and they don't know it, and they could get carried by the wind more than 6 feet. It's generally not transmissible airborne, so if someone has it in Hamburg, it's generally not going to get in the air and be caught in Buffalo or Lackawanna. But if you're in a smaller group, and I saw people in smaller groups, it could happen. I mean, there's reports that it could transmit like a sneeze or a cough over 20 feet. I would not recommend it. I don't know. I know people want to be social, and we want to continue to be social. I posted my music videos. I may do some more of those in the future. I posted some photos of some sky watching through my telescope. People seem to like that. We do need to socially connect, but we have to do it in a smart manner. The people in Italy seem to have it in other places where they were doing it from their decks and they were away from each other. But if you're putting your lawn chairs 5 or 6 feet away from each other and thinking I'm safe because I'm 6 feet, I don't know about that. And I'd hate to have to go to that senior complex and then be picking people up with ambulances to take them to the hospitals. It's not worth it. People, you can wait. I was thinking about this recently, and my grandfather told me about how America came together during World War II, and he went off to serve, and how people back home, what they did. I think my grandfather would be very angry right now with our country, watching the people who are so selfish, who are saying, I don't care about this, I want to go back to work, if people die, who cares? I mean, my grandfather would be smacking him about the back of the head, saying, what are you doing? We are all in this together. And that's what America's always been about, is about being together, in it together, understanding that we are in it for the greater good. And a lot of people don't seem to care about the greater good lately. They only seem to care about themselves. We need to be in it for the greater good of each other. As soon as I'm done with this, I'm putting this mask back on. And I'm going to wear it till I get to my office. And then when I get to my office, I'll probably take it off, because I don't want to infect other people. The individuals who are in this room are further than 6 feet away. They're 10, 15 feet away. But if I sneezed and I coughed, I think they'd be a little concerned. And they're wearing masks. If you're at a party and everyone's having fun, having drinks, and someone sneezes and coughs, you're putting at risk everyone else. Let's be in it together for the greater good, to be each other's brother and sister's keeper. As I said, if my grandfather was around, and he used to tell me about what we were like back in the 40s, what it was like when this country came together to fight fascism in World War II, I know he'd be very disappointed right now seeing the selfishness of so many people who are more interested in a job, more interested in having fun and partying than in protecting one another. He'd be mad. And if you can tell the truth, I'm mad too. Last question.
Last question, Mark. A lot of focus on education. The other E is the economy, economic development. Is the county doing anything with local chambers, with local IDAs? Is there any plans to maybe create or develop some kind of group or organization, a task force, to kind of start addressing some things, both short-term, long-term, and then maybe more importantly, as we get through this crisis, a strategic plan on helping to revive the local economy?
Great question to end with, because you will be hearing from me this week the official announcement regarding our Erie County Economic Task Force. For the last week, a number of people in my administration, including Deputy County Executive Maria White, Senior Economic Advisor Andrew Federick, have been working with others, including Dottie Gallagher of the Buffalo-Niagara Partnership, Steve Weathers and John Capolino from the ECIDA, Jeff Szymanski from the Workforce Investment Board, as well as others, on coming up with a task force and the logical plan. I have been in touch and contacted and spoke with Renee Jones, the chairman of M&T, with regards to this task force as well. And we'll be announcing the members of the task force very soon, probably the early part of this week. We're just confirming all the task force members and their participation. We'll also be announcing what we anticipate from the task force, which is the ways to best help our local economy now and rebuild it in the future when we get through this. We know it's going to be difficult. We know it's a tough time, and it's not great for our economy. We're expecting huge revenue losses in the second quarter and then possibly the third quarter of this year. We're all in this together. Our country has seen worse economic conditions before. We have gotten through those economic conditions to be a stronger country. The same will happen in this region. We've had terrible times with our economy. I remember what it was like in the early 1980s when the steel mills closed. It was horrible in the city of Lackawanna, but we've gotten through that. We've become a stronger community, just like we're rebuilding the old Bethlehem Steel site. We're going to continue to rebuild our local economy, and this economic task force is going to help. We'll be announcing we'll be announcing all the members of the task force soon, but that we're going to announce hopefully in the next, if not 24 hours, 48 hours, the chair people. We'll have one person from outside of the business community and another one from the business community who will be the chairpersons of this economic development task force, which will be focused on what we can do to best support our businesses currently and then get them on their feet if they've had to shut down in the future. With that, thank you for your questions. Appreciate it, from questions to the media as well as the general public. Once again, just a Update, there are over 1,000 confirmed cases right now in Erie County. Let me go back to my COVID map. I'm still searching for that site and couldn't find it. But the COVID map I can find, I think it's 1,057. Yes, 1,057 confirmed cases, 864 active cases, 167 have recovered, 26 unfortunately have died. You can use the interactive map to check out how many cases are in a particular location. Unfortunately, the city of Buffalo has the most cases now with over 400. Even the city of Lackawanna, which only had a couple cases for a while, they're now in double digits at 10. And there are some other communities. This is Marilla. Marilla's had a confirmed case in the last couple of days, as well as some of the others. The only two towns that do not have a confirmed official case are Sardinia and Collins, but we know it's there. We know it's there because it's everywhere. So be safe out there, be smart, be your brother and sister's keeper. Stay home, stop the spread, and you'll help ensure that we get through this together. And when I say stay home and stop the spread, it's so that we can reduce the contraction of COVID-19, the passage of the coronavirus, which then reduces the number of hospitalizations and reduces the number of deaths. If you don't care about yourself, at least care about your neighbor, care about your family member, care about your grandparent, care about the person that you haven't seen in a while, but your Aunt Ginny, you're like, hey, I don't want my Aunt Ginny to get it. The best way to do it is stay home and stop the spread. If we do that, we will be a better community for it, a better county for it, and let's get through this as quickly as possible, and we will be a stronger community in the long run, because we will all remember what happened in 2020 during the great COVID-19 coronavirus pandemic and how we worked together to be a stronger, better community. With that, thank you and have a good day, everyone.